Thank you very much, Chairman Barrasso and Vice Chairman Tester. Really appreciate you pulling this together on this incredibly important subject. The loss of one child's life is debilitating for families and I think for the entire community. In my home state of New Mexico, we've lost far too many young people in our native communities. Just like Senator Heitkamp talked about when I was Attorney General in New Mexico and then a congressman before I got into the Senate, the numbers were way, way too high. Just to throw one at you, New Mexico Department of Health estimates that at least 201 Native American youth have died of suicide between 1999 and 2013. And there's been evidence of suicide clusters, a series of 2 or 3 suicides in a community over the course of a year or less, occurring on the Mescalero Apache Indian Reservation and also the Eastern Navajo Nation. It is likely that the statistics are significantly undercounting these tragedies. There are also high concentrations of risk factors in New Mexico's Native communities. Last year, in a survey of 1,300 Native Americans from 7 different tribal communities in the state, the University of New Mexico researchers found that 29% had been exposed to 4 or more traumatic experiences as children, such as alcohol, drug abuse, physical violence at home, neglect, abuse, separated or divorced parents, or a close family member in prison. It is critical that we listen to our Native youth and remove the stigma on talking about suicide and trauma. We must create and sustain opportunities for them to learn the value of their cultures and identities, and we need to make sure that they are connected to adequate mental health services. We must show them that their lives matter. And I want to thank the witnesses for being here today and all the hard work that they've done in their communities and in the crises that are occurring around the country. We must do better. Thank you very much, Mr. Chairman. Mr. Chairman, Dr. McSwain, Senator Heitkamp asked about brain research in this area, and I know you probably knew brain research and heard the discussion between Dr. Flambois. Do you have any thoughts on that from the Indian Health Service perspective? Your work with SAMHSA, is this a fruitful area? Is this something that we should be looking into, some of those latest things that are being discovered?
I don't think we can leave any rock unturned, brain being one of them. I think that the fact that we are a healthcare delivery system, but we'll be looking to other folks, the professionals, if you will, certainly the NIH folks and others that do this kind of work, and anything that can help. But it's not going to be as easily magical as that. In my view, it's going to be a partnership that happens between the administration and the tribes. And that's the partnerships that's going to be able to give them the tools. And I'm making an observation, some of our communities are just paralyzed because of the suicides. And so we've got to do more to help them feel that they can do something. And that's part of our administrative responsibility. But in terms of science, I'll leave that to scientists.
Yeah. Well, thank you, and thank you for your work in this area. Teresa, thank you for your work with the Zuni Pueblo. That is a Pueblo in New Mexico, long-time Pueblo, really care about their young people, and so they, when they learn what the right thing to do is, they really invest in it, and that's good to see that you were out there. I'm wondering, were they able to incorporate these things in the schools and in other areas in order to make a real impact?
It's made a significant difference, and I don't know if you recall, but Mr. Lewis, I think, testified here in 2008 that it basically really reversed the suicide rate. Seldom happening now, and they still use the curriculum.
Using what you talked about in your testimony.
Yes, they use it's a required course in the high school, and I was back there a few years ago, and actually the families were having meetings in the evening because they were actually doing more cultural adaptation of it. So, yes.
What should a community do if they have one of these clusters? I mean, I've been to several of my tribal communities when in a period of weeks, they lose 2 or 3 of their young people, and they may have not had this happen before. How do you view the steps that should be taken to tackle it if they run into that kind of situation?
Well, first of all, I have to defer to people who are clinical interventionists on the ground. I've focused in recent years more on prevention.
Right.
But
right.
in essence, I think that, having a rapid response and bringing people in that have dealt with trauma, and also communities, and I'm sure that Chairman Siki knows more about that from their experience with the trauma that happened years ago at Red Lake. But basically, there's work in place. But I'd be better people to respond to that question.
Chairman Siki, would you like to respond there?
Are you talking about the trauma that happened during the shooting?
The suicide clusters.
Yeah, suicide clusters.
Deaths.
Well, suicide clusters. Well, we suffer high suicide incidents and suicide ideation by our children for many years. But the major factors underlying suicide rates are long-standing substance abuse, poverty, and generation trauma. This is not a cluster, but a sustained rise in suicide rates. And having more counselors in meeting with students individually, because right now the ratio is 1 counselor per 290 students, and it does not work. We got to have more counselors, more social workers to address these issues we have in our school system, plus our reservations. And it's not easy to fix things just like that. It takes time because people suffer a long, long time. And when it happened in Red Lake, people are still suffering at this time. And the suicides that are going on in a reservation is like some counselors that I talk to say it happens, like one happened in one area, and then there's others that these are friends saying that they want to do it in more or less like maybe 7 or more people doing it at the same time. But it's not easy. It is work that needs to be corrected by adding more counselors and social workers, as I said, but working together. But everything all starts at home. The parental involvement and like this poverty and no jobs, creating more jobs for the families so they can address these issues with their children, because everything leads right into drug abuse and alcohol abuse when all this is not in place. So it's very hard for our people back in Red Lake, that what we face, to continue trying to address these issues with our Native youth, because it's a problem all over, not just Red Lake. And I heard Pine Ridge and this lady talking about different ideas, and Mr. Swain up this way and my right. Those are the things that you as elected officials got to come up with ways for us, for Tribal Nation, invest with the tribes so they can fix their infrastructure to gain these ideas to improve the system, what's happening with our youth in our reservations. And we need help. It's just not just us, it's everybody. Everybody's got to be involved, all the way from the parents. And you got to listen to, like Senator Muskowski talked about children's ideas. You got to listen to the youth, what their ideas are. Pick that up, use that as working together to resolve these issues. But it's not going to happen if we keep cutting funds to the reservations, the sequestration. Those are the dollars they lose for creating more jobs, for bringing in more counselors and social service people, social workers. If this has been reversed, if sequestration reversed, it could be fixed in 6 months or less if it goes back to 2013. But yet, that's not enough. There's more to it to create these programs and not give up, follow, the traditions of our reservation. We need more culturally based, and for our people to understand our culture and to teach our youth what it is to be a Anishinaabe person, because it's not easy. It is hard. I'm just now a chairman for a year, and I'm very sensitive talking about our youth because I know they have problems, but I like visiting with them, talking to them, find ways to resolve their issues. But also bullying is a big concern, but yet it leads right back to coming from the parents. Parenting needs to be focused because it all starts at the home.
Mr. Chairman, you're absolutely right, and I think you're right about the underlying causes. We have to tackle those. We have to invest the resources. We shouldn't be cutting in terms of the kinds of resources that are there, and I thank this panel very much. Yield back.
Thank you, Senator Udall.